Now, the Health Department has confirmed the first cholera death in South Africa. That's our breaking news story this afternoon here on eNCA. The Health Minister Joe Phaahla says the number of laboratory-confirmed cases has now risen to 5. Department spokesperson Mohale is joining us now via Zoom. Good afternoon, Foster. Thank you very much for your time. I understand you are busy, you're running into a meeting, but thanks for making time for us. Tell us more about this cholera outbreak.
Good afternoon, Dan, and good afternoon to your viewers at home. Yes, indeed, we can confirm that the country has reported 2 more laboratory-confirmed cholera cases, of which one of them, unfortunately, the patient has passed away.
And which areas were they from? I read earlier that the individuals came from Gauteng.
Yes, we can confirm that both cases were detected in Gauteng. The first one was detected in Alexandra Township, not far from Sandton. The second one, of which the patient has unfortunately passed away, was detected in the Ekurhuleni area in Wattville, around the Benoni area. And the patient was admitted at Tambo Memorial Hospital. That's where he passed away.
Yeah, now, according to what we've said as well, they haven't traveled. These 2 gentlemen had not traveled anywhere locally or internationally. The first time we had an advisory from your department a few weeks ago was that the first cholera case had been detected after a traveler from Malawi had arrived in our country. What would you think would have caused the infection in these cases?
Yeah, look, remember, currently we are experiencing the torrential rainfalls, but also, as we said, that people are moving from one country to another. There are a lot of people who are moving between South Africa and the neighboring countries. But also, we also want to remind our people that cholera is not only, the outbreak is not only in Malawi, but also it has spread to other neighboring countries like Mozambique, Zimbabwe, and Zambia. And we know that there are a lot of people who are moving between these countries and South Africa. So hence we want to appeal and encourage all South Africans or anybody who experience cholera-like symptoms, talk about vomiting, body pains, and diarrhea, to go to the nearest health facility for screening and testing in order to ensure that if indeed they they contracted the cholera, the healthcare workers, they can urgently assist them in order to manage or treat this successfully before it causes serious health complications.
Yeah, besides the advisory you've just given and creating the awareness, how else is government going to plan to stop the spread of cholera? Because we're still in the rainy season.
Yes, definitely. Yes, we also want to appeal and remind our people to ensure to maintain hand hygiene every time before and after eating, before and after going to the bathroom, to ensure that they wash their hands before they eat, before they prepare food, before they serve the food, but also to ensure that all the foods that they eat, especially fruits, you remember that people, when they buy fruits like your apples and pea and others and peach, they don't have to remove the skin. So we encourage people to always ensure that they wash those food. But also we want to discourage people from drinking from dirty from the rivers or wells where they cannot confirm that indeed the water is clean. But also, what's more important, we want to also remind our people to ensure that at all times they must continuously use the sanitizer, because sanitizer was not only meant for COVID-19, but also for other preventable diseases like cholera.
Yeah, so the rainy season is still with us. We have 5 cases now, laboratory confirmed cases. Are they all from Gauteng, like the gentleman from Alex and Benoni?
Yes, all. Remember, the first 3, they were detected from people who are staying in Diepsloot, which is also part of Gauteng, and the third one, the fourth one here in Alexander, which is also part of Gauteng. The 5th one also in Ekurhuleni, which is also part of Gauteng. So, this suggests that we might be having more cases than what we are currently having. So, hence, we want to appeal to our people to say, please, don't waste time if you experience any diseases. Of course, cholera diseases are, symptoms that are not completely different from diseases, symptoms of other diseases. So we say don't waste your time. Go to the nearest health facility in order to enable the healthcare workers to detect if indeed you contracted this infectious disease.
Thank you very much for your time this afternoon on Today on eNCA. Mr. Foster Mohale speaking on behalf of the Department of Health about the first cholera death recorded in South Africa, and the number of laboratory confirmed cases is 5, and all of them are in the province of Gauteng. Please do to take care how you deal with water. It's still in the rainy season, and contaminated water is one way through which cholera can be transmitted.